Welcome back to another live session with Refined Skin and Body Clinic. My name is Charity and I'm here with Dr. Chirag Kotecha, who is always answering the questions that you keep sending us on our DMs and our WhatsApps. And today we are talking about unlocking the secrets of youthful skin. I'm sure you look at Doctor's skin and you think he's still a teenager. No. It's because he uses refined skin and body treatments and products, and myself as well. So today we're going to be looking at the anti-aging innovations that Refined Skin and Body Clinic has. Yeah?
Sure.
I'm informed that there are around 6. We have the hydrofacial.
Correct.
The skin, the peeling.
We've got many different treatments. We'll talk about them, yes.
Yeah, and he's going to explain them to us, what they do, what are their side effects, if they have a side effect. Personally, I have done the hydrofacial and I can testify that it is not painful at all. It's so refreshing and you feel like a baby after you have done that treatment. But before we continue, we're going to sip a cup of tea. Mm-hmm. Doctor, let's not let it get cold. So I think the first one that we're going to talk about is the hydrofacial.
Okay.
Many people have heard about it. There's a time a friend of mine asked me if the hydrofacials are painful, because the ones she's been having, I don't know where she's been doing them from, she feels pain whenever they're doing the procedure. And I've had, I think, 2 now from Refine, and you can sleep through it. I can testify.
Yes, it's very, very relaxing. First of all, what I want to say, the hydrofacial, what is this? Hydra means water, facial is the face. So it's a water-based exfoliation of the skin. To understand the concept, you remember the skin is a constant, it's the largest organ in the body.
Yeah.
Constantly evolving. You've got different layers of the skin. To put it simply, you create your skin cells, what you see on top, in a deeper layer of the skin called the dermis. Then they migrate upwards to the epidermis, which is the top layer. Then what you see at the top are dead keratinocytes, or dead skin.
Yeah.
So this exfoliates that. This turnover process of skin cells takes about 21 days.
Yeah. I think, Doctor,
21 to 28 days.
Some people might not be understanding what exfoliation
just
means.
Removing, shedding off. So the process of new cells being formed to coming to the top takes anywhere between 21 to 28 days. By doing the hydrofacial, you're making that faster. So it stimulates collagen synthesis, so it makes your skin look younger, more refreshed, and so on. Now, hydrofacial, it's used for many types of machines.
Yeah.
The one at Refined Skin and Body Clinic is the original hydrofacial machine from the USA, the hydrofacial MD. So it's a patented, it's a special kind of machine that uses different kind of serums. It's a multi-step process to help cleanse the face, exfoliate, again, remove the dead skin, hydrates and moisturizes the skin. We use different serums, different chemicals or fruit extracts to help the skin turn over. Very safe, very relaxing, pain-free. However, people say that, I reacted to it. Yes, because the new skin cells you form actually are sort of the immature skin cells that you see on top when you remove the dead skin. So some people say, I've got a fine rash for a few days. If you've got any acne, it helps clear that up. But usually some people see that there's a bit of downtime, not all the time. Sometimes a bit of downtime before you get the fantastic results. However, it can be done on the same day that you're having a function, a party. So if it's the first time you're doing a hydrofacial, I don't recommend you to do it when you've got an event, a wedding at home. Maybe if you've had it a few times and you know the feeling or the outcome of it, you can do it then.
You're sure you're not going to react to it.
Yes, but because some people do react to the different chemicals. So we start off at a low concentration and build up.
Yeah.
Recommendation is once a month for at least 3 months. After that, you can do it quarterly or every 3 months after that. However, it is even safe to do every month. There is no harm at all. We've got patients who do it religiously every month. To maintain the quality of the skin.
Okay. So for my friend who was complaining that wherever she did hers, it was painful, that whatever method they used to do the hydrofacial wasn't the original.
No,
it's just her skin type.
I wouldn't say that. There are different. We've also got a facial. We'll talk about the Cleopatra facial, which is a bit more of an advancement to the hydrofacial, which has micro needling, micro channeling, where we use sharp pins to stimulate collagen to help close up the pores. So that can be a bit painful. There's different layers, levels of treatment. So when I say people use the word hydrofacial loosely, so your friend might not have had the hydrofacial. They might have had a different type of facial, which would have had some of the steps of the original hydrofacial, but that would have been what would have caused the pain. If she had severe acne, for example, yes, some patients, when they do our hydrofacial, if they have severe acne, which is the hydrofacial is beneficial for, it can be a bit painful at that time. Depending on the level of suctioning, because you can control the level of suctioning, the way it's pulling up the dead skin. So it can be a bit of discomfort depending on the sensitivity of the skin.
Okay, great. There's a misconception. I don't know if it's a misconception, but some people believe that when you do a hydrofacial, you get brighter or lighter. Like, is that an after effect? Or is it supposed to do that to you?
See, hydrofacial is one of the steps in your skincare routine. Don't rely on just the hydrofacial alone. You also need a consistent skincare routine that you're using at home as part of your anti-aging benefits. You should be cleansing, mild cleanser or fruit-based cleanser depending on your skin requirement. Yes, the serums, sunscreen definitely a must, especially here on the equator where we live. We've got retinol, which is for anti-aging, used at night, or tretinoin. So it's a different combination. And what often I see patients doing is to avoid paying, say, the 70,000 consultation for me, or another clinic might charge different consultation fee for the doctor, is they say, let me not do that, let me just go to the pharmacy and pick up products. And then they're reacting to different products because they're either putting too much on the skin or too little or not the right products for their skin type. So avoid that headache. By taking those shortcuts, in the long run, you end up spending more money. Come for the consultation, speak to the doctor, whether you want to buy products from us or you're the provider, it's up to you. Go to the pharmacy, it's up to you. But it's better you consult somebody, understand the whole skincare routine, the process, how to make the circle complete. You're having your facial treatment, whether it's the hydrofacial, the chemical peel, the Cleopatra. We're soon introducing the carbon facial. You'll see about that coming soon. We've got our new machines that have arrived, which I'm excited about. And with the skincare routine, things are better. Now, this is not a magic wand. If you're age 50, 60 years old, you've got severe wrinkles, don't rely on just a skincare routine and the hydrofacial to remove all those wrinkles. Prevention is better than cure. Your skin is fantastic. It's better to start now, taking care of the skin rather than waiting for the damage and trying to reverse.
Exactly. You've talked about the chemical peel. Now let's talk about that. What is the chemical peel?
Okay. So when we go back to the hydrofacial and this Cleopatra, as technology has advanced, we all have these all technological advancements using machines. Prior to all this technology, chemical peels have been there. They've been there from Cleopatra's time in Egypt. They've been used in ancient times. People use it at home unrealizing. They say, I put yogurt on my face, I put lemon, whatever they do. So these are all chemicals, what we call chemical peels. They're fruit-based extracts. Alpha hydroxy acid, such as glycolic acid, or beta hydroxy acid, such as salicylic acid. Salicylic acid is beneficial in acne, glycolic acid in anti-aging and in pigmentation, plus there's other ones. Lactic acid, for example, for brightening the skin. So the chemical peel, when we say there's different levels, where they go superficial, which is the top layer of the skin, medium, which is a bit deeper, and the deepest layer chemical peel, which I wouldn't do in Kampala. We've done it before for a patient, but with the weather we have, the sun we have, it's not recommended here because it can lead to hyperpigmentation or darkening of the skin. So keep away from the deep peels unless you're doing it for specific indications, such as cancer, for example. You can use it to help some cancer patients, skin cancer patients, such as benign cell carcinoma. It can be used for BCC, it can be used for those. Now, chemical peels, it's a liquid. You come in, we just apply a liquid on your face, and it's to exfoliate the skin. Now, again, a big misconception, people say, when I come for a chemical peel, my skin has to peel. It does not have to peel. You don't see, most often you will see your visible skin sort of coming off and peeling off. So for people who can afford that downtime, or not in the corporate environment, are not working, or even if they're working, they don't want people to see them with the skin coming off. that chemical peel should not be for them. If you don't mind being seen around with your skin peeling off,
How
then do
long
the
is
chemical peel.
that peeling?
It can be anywhere from 1 to 2 weeks.
What?
Yes.
1 to 2 weeks.
So we can do it on the body, on the face. It's more cost effective than the hydrofacial, because we can do the hydrofacial for the body as well, for the back. We can do Cleopatra treatment for the body and the back. The chemical peel is the most cost effective. So I have patients coming with dark elbows, dark inner thighs, knees, whatever. We can use different types of chemicals to help exfoliate that. Again, with the home care routine, don't just feel that doing the chemical is going to sort it out. Use your sunscreen. But the idea is to remove...
I also have to, if I'm using it to clear maybe dark elbows and dark knees, I also have to apply sunscreen to those areas.
You have to, because as you exfoliate the top layer of dead skin, if you don't protect your inner or the new layer of skin coming up, that will darken as well.
Wow, I thought sunscreen was going to be for the face. I didn't think that it's for that.
It should be for the whole exposed part.
Wow.
So for you, your chest, your legs, if you're exposed out, you should
put sunscreen.
Now, there's different levels of sunscreen. At Refine, we've got the more premium sunscreens for the face. We've got sunscreen sprays for the body. So they're not as expensive, and they're easier to apply. So it's a spray, you just spray it on and rub it in.
So with the chemical peel, is it painful as it's coming off, or
it's not painful as it's coming off. One piece of advice to the listeners: when your skin is peeling, do not peel the skin.
Why?
Do not pull it off, because it can lead to scarring at the junction of where the dead skin to the normal skin is. If you peel it off, you can leave yourself a fine scar. So don't do that. Let it fall off itself. When you're washing your face gently, or you can use a pair of scissors to snip off the dead skin. That is also okay. Like your manicure scissors, you can just use it to cut off the dead skin. But don't peel it off. But there's not always peeling. So time and time again, I do get patients coming in saying, I did a chemical peel last week, I didn't peel. I'm like, I can't do anything. I have to wait the full month, because yes, there is definitely a process of skin exfoliation, whether it's microscopic. So you ask them, when you wash your face, do you feel some grit and some roughness? Yes, I feel that. That is your dead skin coming off. You don't necessarily have to see visible layers of skin coming off. And again, there are different levels of chemical peels that we have at Refine, and with other clinics also, different levels of chemical peels. So speak to the specialist. Don't avoid consultation just to go in and choose the chemical peel. Let the therapist say, oh, 3 months ago, last year, I did this chemical peel with salicylic acid from acne. Now I don't have acne, but I want the same chemical peel. Why? You might as well have a different peel that is better for your skin at this time.
So how, you mentioned that doing the chemical peel is more cost effective than the hydrofacial, because the hydrofacial, you mentioned you have to do it consistently for at least 3 months. Then you can start doing it quarterly.
I don't mean cost effective, but it's cheaper. Here, Refine, our chemical peels are a bit cheaper than the hydrofacial, depending which one you choose.
So, okay, maybe the normal chemical peel, how often should someone do it, or is it a one-off?
No, again, it's not a one-off. It's not a magic one. You've suffered from acne, or you're 25 years old, you've been not taking care of your skin. Don't expect us to come be magicians and do one chemical peel and you're back to normal, or your skin is resolved. It does require 3 or more. And again, there is no harm. Like I explained, the skin process turnover, 21 to 28 days to turn over the skin. So you can do a chemical peel once a month, and there's no harm depending on the concentration we're doing. There is no benefit in doing a deep chemical peel every month. That is too strong. But a light superficial chemical peel every month for 12 months, there's no harm. It just helps that skin turnover, keeps your glow happening there, your skincare routine. For our listeners again, if you're on any active ingredients, tretinoin, retinol, people use it all the time, retinol, retin-A, tretinoin, make sure you stop that for 3 to 5 days, depending on the color of the skin. The darker your skin, the longer you have to stop it for before doing a chemical peel or a hydrofacial. So if you're fairer, so I might have to stop it for 3 days, you have to stop it for about 5 days before having your treatment.
So still, it goes back to making sure that you have a consultation first, so that you can examine your skin, know how long you're supposed to do it, what you're supposed to be using. And
our therapists here at Refine have been well trained. A lot of the ladies here have been with me for many, many years. So they now know what to look for. They can actually make recommendations. But when it's a bit complicated, yes, they do refer to the specialist. We have a team of specialists at the clinic for advice and consideration.
Next, we are going to talk about microneedling. You mentioned it in the when we're talking about the hydrofacial, that they put some tiny needles and they keep piercing. Yeah, so tell us, what's the science behind that?
So micro needling is, again, as it says, micro, small. Needling is the needles. It's anywhere between 14, 24, 32 needles we have on our device, Rejuva pen or the doctor pen, whatever device you're using. It helps create small, controlled punctures into the skin through which you can apply different actives. So if you don't apply anything, for example, the micro needling process itself disrupts a bit of the collagen, stimulates your body's inflammatory process, so your white blood cells in the body to come and heal that area.
Yeah.
By causing that healing or that micro-inflammation, it starts stimulating collagen formation. So you have scars, you have acne scars, you have stretch marks, you have open pores, you have balding. Microneedling can help come and stimulate that what you call neocollagenesis, new collagen formation.
Okay.
To help reduce the wrinkles, to tighten the face. Now, through those micro channels, micro needling, you can apply different actives. So you can do sort of mesotherapy, where we put in small different cocktail of vitamins, amino acids.
Yeah.
You can put in your plasma, your blood. So we have people doing the vampire facial or the PRP facial, where we take your blood, we process it through the centrifuge, you get your plasma, and then we can put that into the skin. Now, this is again a bit more powerful than straightforward microneedling alone, because when you add in the actives, you're again stimulating more collagen, new skin formation, reduction of wrinkles. So that's where the micro channeling or microneedling comes. Now that one again is recommended once a month for 3 months again, then maybe every 6 months for maintenance, once a year, depending on how deep you go.
Okay. What are the side effects for such a process?
First of all, it has to be done in a clean environment.
Yeah, because I imagine blood.
Clean, sterile environment. Yes, we're handling blood, so there's always issues of bacterial contamination.
Infections.
Yes.
Yeah.
So make sure it's in a clean environment. Go to the clinic. If you go to any clinic and you walk in and you're not entirely sure about the cleanliness of the area or the sterility of the area, do not have the treatment done.
Yeah.
Once you get the product done, ideally here we want to make sure, refine what we do is we process one patient's blood at a time. So if we do have multiple patients having the same treatment, we will not process the blood in the machine at the same time. We'll do one patient at a time before we take the other patient's blood in.
How long does this process take?
Well, first you probably put anesthetic cream, so we numb the area because it is a bit painful depending how deep you go. So we numb the area. So we put anesthetic cream for anywhere between 30 to 45 minutes.
Wow.
We take the blood, put it through the machine for anywhere between 5 to 10 minutes, and then we microchannel or microneedling. That itself depends how deep you're going. Your pain threshold can take anywhere from 10 minutes to 30 minutes. Then we put an LED mask here to help reduce a bit of inflammation, just to help rejuvenate you with the mask. So you're looking all in all an hour and a half being here for the procedure. Then you go home with those if you've done your plasma or the ingredients, the active ingredients, you leave them on the skin, wash them off the next day. So maybe 1 or 2 days downtime, if anything, depending on the depth we are going. We have patients who say, look, I don't want to do it once a month for 3 months and repeat it every 6 months. I would rather do it every month, but don't go deep. So we go superficial, and they can do it monthly.
What?
Depends on the depth. The deeper you go, the longer you have to. I mean, you can have longer gaps in between. But if you're going 0.25 millimeters, 0.5 millimeters, it's very tiny on the skin. You can do it monthly without harm.
Right. So for patients that have identified a clean clinic with sterile instruments and they're sure of the safety procedures, are there any side effects that they should expect? Maybe swelling of the face,
so possibly
redness?
depending how deep you're going, you can have a bit of swelling. There can be some bruising that can happen. Again, if not done in experienced hands, it can lead to scarring.
Yeah.
So we use it to treat scarring, but if not done properly, you can cause scarring also. So there are different risks. But ultimately, if you're using your blood, for example, using your body's own healing factors, you can't react to your own blood. If you're adding other active ingredients, yes, there could be a possibility of an allergic reaction. However, a lot of the products that are used in microneedling and PRP facials are really inert. They don't cause much of a reaction in you, except that bit of inflammation which is required. After the treatment, we tell you to avoid anti-inflammatory medication or antibiotics. For example, we got people who suffer from herpes simplex or cold sores.
Yeah.
That can spread if you're not managed properly, so they need medication to help that. They should avoid things like Brufen to reduce the inflammation, because the inflammation is what causes the collagen formation.
Right. So my last question on this procedure would be, there should be, I'm assuming, an age where such a procedure should start? Because I don't think.
Well, you can do it anywhere. I mean, personally, I've been
Yeah.
recommending it from the age of 18.
Okay.
We can do it anytime. However, new studies have shown even the age of 16 you can do.
Really?
Now, when we talk about anti-aging, this is something which you should know, all our listeners should know.
Yeah.
When we talk about patients coming to me all the time, and they say, I was trying to talk to them, do you want to consider anti-aging treatments, which is introduction of, say, retinol into your skincare routine, considering the facial, the chemical peel. They're like, doctor, I think I'm not yet old enough to start anti-aging. I'm not 40 years old. Now, if you think of the word anti-aging, anti is
Aging.
prevention,
Yeah.
aging. So it's better to start early, 20s even, because from the age of 20, your levels of vitamin A, which is your retinol in the skin, levels decline. Your collagen turnover, collagen formation levels are low. Your type 4 collagen, which you have, which is predominant in the skin, levels are reducing. So you should start using these treatments earlier.
Okay.
Prevention is better than cure.
Definitely.
And I wouldn't say treatments, it's getting into a good skincare routine, remove your makeup before you sleep, drink lots of water, avoid smoking, use sunscreen. So these simple things should be implemented at an early age. My wife is very particular for our children, for example. They get sunscreen on from the age. My children are 9 and 7 right now. They've been using sunscreen from a young age.
Wow.
Before going to school, because they play outside all the time.
Yeah, I mean, kids.
You want to preserve the quality of the skin. We're all living longer than our ancestors did. Healthcare is better now. People are making more informed decisions, eating a healthier diet, so they live longer. You should start taking care of your skin from a young age.
Okay. So our next treatment, anti-aging innovation at Refined Skin and Body Clinic, will be the laser skin resurfacing. Tell us more about that.
So when we talk about laser, this is an interesting topic I had yesterday actually with a patient. He said, we were talking about his scars on his face and he had beard. And he said, I'm concerned. When you talk about laser, people think that, when I do laser, my hair will go. That's the most common myth that people in Uganda have anyway.
Okay.
Because for us, cosmetic treatments and these treatments have not been around for long enough. They think laser, my hair will go. So there's a different targets for the laser. What we call the chromophore. The target for laser in laser hair removal is the melanin in the hair. For skin resurfacing, we target the water. So we have the CO2 laser. We have different types of skin rejuvenating lasers where the target is the water. So by targeting that, it causes disruption in the skin barrier to help stimulate, again, collagen synthesis at different layers. So we can use radio frequency, for example, with microneedling.
Okay.
We can use the CO2 lasers. There's different modalities, different treatment options for people. Now, whether we use one or combined treatments is a very important factor because, again, reversing aging or prevention of aging is not just one treatment. I can't expect you to eat matoke for the rest of your life. You will need to mix your diet. Exactly. So even in terms of treatment, don't expect me just to do chemical peels and manage your skin.
Or hydrofacials and
exactly. We need to do a combination of things to focus on different areas. When we talk about Botox, fillers, the lasers, there are different combination treatment is the best way. People want to go for a more natural looking appearance. They don't want to look in over treated or plasticky, what you see in botched, for example. So we have to combine different modalities. And often than not, it's not just one treatment that will sort you out. You may need a series of treatments initially, then you maintain. Whether you visit the clinic once every few months or once a year to maintain the quality of your skin.
I have an interesting question. We're in Uganda and the economy is not the best most times. And there's this young girl, she wants to look young forever and ever and ever. And you've mentioned that we have to make sure there's a combination. You can't just do hydrofacial, you can't just do microneedling, you can't just do the shedding of the skin. What advice would you give for someone that's on a budget?
First of all, start early in terms of your prevention treatment. So like I said, eat a healthy diet, lots of fruit and antioxidants, drink lots of water, avoid smoking, remove your makeup. If you have any skin concerns, it's better to get them addressed early. Don't go to the pharmacy, don't go to what your friend used will not work for you, for example.
Yeah, definitely.
Don't do that. More often people come, I've got patients who say, my friend was using these products of yours, I decided to use the same and they're not working for me, or they've reacted to my skin. Again, that's the wrong way to do it. Just come in and buy it. So if before things get worse, get them addressed by the doctor because it will be more cost effective. Consistent use of skincare routine, the sunscreen, the cleansing
The
at home, retinol. Retinol will react with the skin most often in the beginning, but it helps, it does settle down. So in the beginning, do use it.
Yeah.
And things will improve. It's used for acne treatment, it's used for pigmentation, it's used for anti-aging and so on. So the thing is to have a consistent routine.
Exactly.
See the specialist early. Don't expect what is working for your friend to be the same treatment for you. And those are the simple pieces of advice. In terms of routine, what I like to say, there's a saying, what is cheap will turn out to be more expensive than
Yeah,
long run.
always.
So we have people buying these downtown products that are mixed with steroids, mixed with hydroquinone. They work well in the beginning, then they come in and their skin is uneven. They look like a zebra, half colors. They've got stretch marks. So now addressing those problems, correcting damaged parts is more difficult and more expensive. So don't jump to that. In the beginning, spend that 50,000, 70,000 consultation fee before you consider what skincare routine to go on to. Start that simple program. Maybe you don't even need to go for a consultation if your skin is fine. Cleanse. Use a nice serum with hyaluronic acid or vitamin C. Sunscreen, definitely SPF 50. Look for a 50 plus SPF. Retinol if you can manage it, or tretinoin. Moisturize at night. Vaseline, I think, is a fantastic. Vaseline petroleum jelly if you don't have any skin issues is a nice moisturizer for the night. Cost effective, again, not expensive. People think it clogs up your pores. It doesn't. Studies have shown that it does not clog up your pores. You might feel that applying the jelly will clog up your pores and lead to acne. That is not the case. Studies have shown it. They've studied scientifically. It is not the case. It will not make your acne worse. So it's a good moisturizer to use at night.
My last question is, you've mentioned that for sunscreen we should use SPF 50 plus. What is wrong with, because right now it's been raining from I think Monday. It's been raining a lot. Would you still advise someone to still use a sunscreen of SPF 50 yet there's not so much sun, or can I use the 30?
No, the number is really about the time exposure. So for example, if both of us went into the sun and I didn't have sunscreen and you had sunscreen of 50, you would have to be in the sun 50 times longer, so 50 minutes, for me 1 minute, to have that same kind of UV exposure. So that's the factor. So where we are spending time in the car, in the house with windows,
you can use a 30.
Why would you want to have two sunscreens? Most of the time the environment here is hot enough for that, sunny enough that we need the 50, unless you want to have two different sunscreens sitting at home.
I mean,
why would you do that? You find a sunscreen that suits you and you continue with that. So when you're starting, I do recommend the 50 plus where we live, and continue with that 50. Unless you're one of those people who's got extra money and wants to buy multiple sunscreens, that's entirely up to you.
And I think the issue with why people have maybe someone might not really be a fan of the SPF 50 is because sometimes, like me, this is a personal experience, I've used one brand and I've used both the 50 and the 30. But with the 30, it's lighter and it doesn't leave that whitish, you don't look like a clown.
Correct. So try and find an SPF 50 that suits you. Try find an SPF. Okay, you can have two, but then when it gets hot, are you going to go back to the 50? Then you'll say that whitish clown. What will you do? Then you'll continue with the 30. So it's human nature. We all get lazy. That if you go that 30, you'll continue using the 30. So to avoid that mistake, and when it gets sunny, it's better to continue with the 50 throughout. Again, people say, doctor, I didn't go out in the sun. I had a chemical peel. I had a Chinese lady yesterday who said, doctor, I'm at home this whole week. Do I really need the sunscreen? I said, you just had a strong chemical peel, number one. Number two, unless you live in a house without windows or your curtains are closed the whole time, you do need the sunscreen, because we've got ultraviolet A and ultraviolet B. Okay, there's other ones also, but UVA, UVB are the most common. One of them bounces off the glass, the other one goes through the glass and gets to your skin. So even if you're not in the sun, you're going to the office, in the car, you're sitting in the office directly, and say, look, I'm inside the whole time, I don't need sunscreen. That's the wrong way to do it, especially if you've had any of the treatments, the chemical peels, the Cleopatras or hydrofacials. Important that you apply
sunscreen. What are the top, let me 4 sunscreen brands that you would advise us to use?
Well, I can't advocate brands.
Okay.
I cannot advocate brands. Okay. Really, there are different types of sunscreens that we have at the clinic. A lot of them are good. You need to find one that is non-comedogenic, that is doesn't really cause pimples, can be chemical free or oil free. Okay, so you need to find one that doesn't leave you those white streaks. What you might not like the white streaks, but another client who's lighter than you is okay with it.
With the whiteness.
So depending on how much they put. So you need to go through the different sunscreens. Again, when you apply sunscreen, a lot of people just take a lot of it and rub it. That's the right way to do it.
How do you do it?
Take a little bit, apply it on the 4 sides of the nose and then rub it in. Because when you do this, you're over applying, a lot of it is getting absorbed or wasted here in the hands. And also, simple tip of advice I tell my patients, it feels very odd, but normally you apply your creams like this. People say, my hands are aging also, so why not try do both together? Just try apply it this way. I know it's very odd, but then you're absorbing the cleansing, your serums, you're getting it absorbed into this part of the hand, which really does then help with improving the quality of the back of your hands.
True. Thank you so much, Doctor, for your time. Thank you so much, viewers, for listening and learning about the anti-aging innovations at Refine Skin and Body Clinic. All these innovations, the doctor has done them himself, because he told us that every treatment at Refine Skin and Body Clinic, he has done it. When he first tests it on himself, then he can give it to you. Any machine that comes in, he's the muse, he's the lab rat here that they use to test the machines and the creams and the treatments. So rest assured that when you come here, it's a clean environment. You can see they really try to make sure that the environment is clean. The instruments are sterilized before they're used on you. So why don't you come on to Refine Skin and Body Clinic at their main branch at Forest Mall, get any of these services, and they do have promotions sometimes. They do have discounts sometimes. So never know. You could come when one of these treatments are on promotion. But as for now, me and the doctor are checking out, and we'll catch us next time for another interesting topic.